Did you know that up to 20% of erectile dysfunction cases are caused by medications? Do you know which medications can cause erectile dysfunction in men? Stay with me until the end of this video and I'll explain which medications can have this detrimental effect on a man's life. Hello everyone, I'm Laura, and today's topic is a very common issue discussed in the urologist's office: medications that can cause erectile dysfunction, often without the patient even knowing. Erectile dysfunction has a very high prevalence in our population. We know that after the age of 40 or 50, at least 1 in 2 men will complain of erection problems. This percentage can reach up to 70 or 80% as men age around 70 or 80 years old. And one of the causes of this problem can be the use of medications, antihypertensives, antidepressants, medications used for rheumatological conditions, which we will discuss one by one. The first class of medications, widely used by the general population capable of causing erectile dysfunction, is antihypertensives. Here we highlight thioides and beta blockers. Thiazides, what are they? Hydrochloroid and chloroalidone. These medications are widely used, including in combination with other drugs, and hydrochloroid, for example, increases the patient's chance of developing erectile dysfunction by 2 to 6 times. Regarding beta blockers, also widely used for controlling high blood pressure, such as propranolol and atenolol, they affect not only the erection, but all phases of sexual activity, arousal, erection, and even orgasm. And look, if you suspect that any of these medications might be harming your performance, there's something you need to see. Recently, thousands of men have started using a completely natural at-home method that takes only 7 seconds a day, and the results have been simply amazing. This method targets the real hidden cause behind erectile dysfunction, something most doctors don't even mention, and can help you regain firmness, desire, and sexual potency without changing anything in your routine. Point your phone's camera at the QR code appearing on the screen, or click the link pinned in the comments. Just don't put it off, because this video could be taken down at any moment. Another very common class which we often find patients using, and which can be related to erectile dysfunction, is antidepressants. Nowadays, they are widely used to treat anxiety disorders and depressive disorders such as tricyclic antidepressants and selective serotonin reuptake inhibitors, SSRIs. What are they? SSRIs include fluoxetine, duloxetine, paroxetine. They are often linked to cases of erectile dysfunction. Regarding tricyclic antidepressants, amitriptyline, clomipramine, which are older drugs that have been used for a longer time. Often the patient reports having always used the medication and that a case of erectile dysfunction started or emerged. In fact, this is very common. Sometimes we need to contact the psychiatrist or the doctor monitoring the patient's psychological condition to try switching to a different medication, substituting it with something that doesn't impact the patient's sexual life as much. Besides antidepressants, we also have anxiolytics medications used in the treatment of anxiety. Here we have medications like clonazepam, alprazolam, and lorazepam, which are widely used today. Clonazepam, sometimes taken as drops like the brand Klonopin/Rivotril, can be associated not only with erection problems, but also with decreased libido. Another class of medication associated with sexual disorders, everyone, is antiretrovirals. For patients living with HIV who use antiretrovirals long-term, the incidence of erectile dysfunction is very common, especially with actziodine. Another class, medications used for rheumatological diseases such as methotrexate, used to treat rheumatoid arthritis, can also be a cause of erectile dysfunction. Other related classes include opioids such as morphine and nalbopine. These medications, besides harming sexual function and potentially causing erectile dysfunction, carry a risk of addiction when used frequently. Unfortunately, many patients become addicted to the sensation of using opioids, and this can directly affect your sexual life. Additionally, Antipsychotics like haloperidol and anticonvulsants like phenobarbital can be related to erectile dysfunction. And finally, other very common medications, which aren't even controlled substances that we use routinely. Some antihistamines like promethazine, the well-known Phenerin, can indeed be associated with erectile dysfunction. Additionally, some older medications used as antacids like ranitidine, which are H2 histamine receptor blockers. Actually, ranitidine is largely being replaced by proton pump inhibitors, PPIs nowadays, like omeprazole, but it can still be a cause of erectile dysfunction. So everyone, it's very important when a patient comes to the office that the urologist asks about medication use. It's always good to ask the patient to bring a list of all the medications they take, as the problem can often be related to chronic medication use, and it's very common for the patient to say, "Oh, but I've always used it and never had a problem." But this issue can arise later. The medication can start to induce a side effect the patient never experienced before. If you found this video interesting, if the content was relevant, please share this information with as many people as possible. Also, subscribe to the channel and activate notifications to stay updated on all our weekly content. See you next time. Bye-bye.